Diabetes is becoming the major public health problem facing the FSM and many other places here in the Pacific. It is the first leading cause of death in Kusrai and in the Marshall Islands, the second leading cause of death here in Bombay, and the third leading cause of death in Chuuk. The World Health Organization predicts that by the year of 2030, diabetes will be the seventh leading cause of death in the world, and this condition demands our attention.
Hi, Mary. It's been a while, never seen you smile. Is everything alright?
Something bothers me lately. Is this the sign of getting older?
Who told you about getting old? Only the Carabao gets older. You know, you should be happy that you have two kids. They're all grown up now. Besides, you and Chano got plenty of time to spend together alone. Don't you think?
Not at all. I have trouble understanding the behavior of my husband lately. His appetite seems increased and grumpy when no food available on the table. And in the middle of the night, he would ask me to cook food for him.
Really?
Yeah, that's crazy.
Maybe you did not prepare enough dinner for him? Or maybe he's not satisfied of what he's eating? Don't you think?
What? He's been eating a lot, yet he seems losing weight. He's been having multiple trips going to the restroom to pee, drinks more water. Then you tell me it is not enough? What is wrong with him?
Mary! Mary! Come over here, I need something.
Seriously? Do I really need to attend each single minute with you? Are you forgetting you still have legs to walk? I am getting tired, Chano. What is wrong with you?
Just give me a soda. I feel weak right now. Look, my left foot is getting bigger, isn't it?
What happened to your foot? Yesterday you were just walking around barefooted, and then you're telling me you didn't realize what you stepped on?
Hurry, cut me a soda. I feel great each time I drink it.
Wake up, Chano. Time for dinner. Chano? Are you okay? Chano! Hey! Wake up! Chano! Hey, Chano, wake up! Chano? Bella? Bella! Can you come over here, please? Please, can you come and see my husband? He isn't responding to me.
Okay, come on, let's go see him. Jano? Jano! Jano, wake up!
See, he isn't responding.
But I thought he was yelling at you earlier asking for something. What happened?
He was asking for soda and he was kind of shaky. So I told him to eat real food. And when I came back, it's already like this.
I think we should take him to the hospital. Come on, help me. You can use my husband's car. Nurse! Nurse!
Yes! Wheelchair! Here, I'm coming!
My name is Mary. Can you please tell me the patient's name and what was he doing before this happened?
His name is Chano Gersa. He was asking for soda earlier before dinner. I came back, he's already like this. I tried to wake him up, but he couldn't wake up.
What was his last meal?
This morning.
This morning. Is your husband diabetic?
Like I said, this is our first time here. It was well for 30 years.
So can you please tell me his age?
He is 45.
45 years old. Okay, I will do this, then check his blood sugar level, and I will let the doctor know. Doc! I have a patient who came in with, he is 45 years old, with chief complaint of unresponsiveness a while ago. Vital signs taken in I took his blood sugar level, it's 550.
550? Is he diabetic?
The wife said this is his first time here, so maybe it's his first onset. Could you please check on him?
Okay, let's go check him.
Okay.
My name is Dr. Young. Can you tell me what happened?
Was asking for soda earlier.
Yeah.
Before dinner, I came back, it's already like this. I don't know what happened.
What's his name?
It's Chano Gersa.
Chan. Chano. 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 Okay, so your husband's blood sugar is too high. I believe it's best if we admit him to check other laboratory tests and control his blood sugar. But if it doesn't respond, I might start giving him insulin. Marianne, give him 10 units of Rudelyn R, and then insert IV fluid plain LR, 1 liter, and I'm just gonna write down the orders and you just check. I have another patient to go to.
Rudelyn R sub-Q?
Yes.
Okay, I will carry out your order.
Oh, okay.
Thank you.
Nurse,
Yes?
could you please tell me again what the doctor said?
Okay, wait, I will call my colleague first, then I will come back to you.
Thank you.
Trine, can you please carry out the doctor's order? It's insulin 10 units, sub-Q. I need to explain what's going on to the family member.
Sure, take your time, you can prepare it.
Thank you. The doctor was explaining to you earlier that we need to admit your husband in the hospital so that we can monitor his blood sugar level because it's 550. It is too high.
What is his sickness again? What is that diabetes?
Diabetes. Diabetes is a chronic disease that occurs when our body doesn't make use of the insulin that our body produces, or the insulin that it produces just stays in there and it can only cause sickness. So I will explain through this. This is our body. These are the lungs. This is our heart, liver, stomach, and this is the pancreas, the one that produces the insulin.
Insulin? What is that? I heard you guys will give that to my husband.
Insulin is produced by the pancreas. Insulin is a hormone that acts like a key to let the sugar from the food we eat pass through our body as energy.
Oh, That is why he's acting so strange in the past weeks.
Yeah, because of his diabetes, so
Thank you so much, nurse. By the way, could you please check on my husband's left foot? It is kind of red and swollen.
when did this happen?
I really don't know. He was walking barefooted the other day, and perhaps he stepped on something and he couldn't feel it.
It looks infected, but don't worry. I will let the doctor know so it can be cured right away.
Good evening, ma'am. My name is Julie. I'll be the one giving your husband his insulin shot.
Nurse,
Yes.
is there any way that my husband can get cured?
Okay, as my colleague already explained earlier, it might not be cured but can be controlled by this insulin.
The patient then is ready for discharge and needs health teachings. Part of the nurse's role is to make sure that the patient and the family are well informed about the patient's condition and how to take care of themselves at home, or we call it self-care management. It is very important that they know the disease process, take part in the treatment so patient comply with medication regimen. Nurses are often the first and sometimes only health professional that a person interacts with, and so the quality of their initial assessment, care, and treatment is vital.
Hi, good morning, Mr. and Mrs. Carrison. I'm Lisa and this is Janeda. We are here to inform you that you will be going home today and we will help teach you how to take your oral medications at home.
Nurse, I'm scared to poke myself with that needle. Is there any way I can just drink the pill instead?
Hey, you should follow them because this is for you to live longer. Would you mind if I could do that for you? Oh, and by the way, this is my eldest daughter. She's also here to help us.
Nurse, I can also help my mom. I'll be staying with them for a little while. And plus, I need to learn how to do these things.
Absolutely, yes. Your father must be very lucky to have such a caring family. All right, let's start teaching you your medications. This is the metformin. You should take 1 tablet twice a day, 1 in the morning, 1 in the evening, before you eat your meals. Understand? There you go. This one is your micronase. You should take it at the same time. 1 in the morning, 1 in the evening, before you eat your meals. There you go. And for the last one, this is your cloxacillin. You should take 1 capsule every 6 hours after you eat your meals. And it is for the food infection. You understand?
No problem, I will take it anytime I feel good.
Not anytime when you feel good, Mr. Carrison. Metformin and micronase are medications to help control your blood sugar level, and they should be taken with meals. But before you take your medications, you need to test your blood sugar level. Here, I have a glucometer. It's a machine to help test your blood sugar level. Let me teach you how to use it. Here is the test strip. It collects your blood sample after you poke it. So first, you insert your test strip over there. And may I have your finger, please, Mr. Carrison? Here. The gun, you put in your needle, screw it closed, cock it back. Here's the button to press when you're ready. Swab your finger with an alcohol-soaked cotton ball, and then you poke it. Immediately put the test strip to the blood sample collected, hold it in place, and it will show you your blood sugar level.
You know what? You guys are killing me slowly. I will be loaded with a lot of shot every day? Man, this is too much.
I will be here to do it for you. Don't be so stubborn, okay? Nurse, how would I know that its sugar is too high?
Dad, please, listen to them.
Mr. Carrison, I know how overwhelming this treatment would be, but this kind of illness will surely affect your life. But as soon as your eagerness to get better is there, you can get used to it. When the result on your glucometer is higher than 125 milligram per deciliter, then it is said to be very high. Mr. Garrison, you have a very beautiful and supportive wife. You will get through this and everything together. Right, Mrs. Garrison?
Oh, yes. No matter how stubborn you are, I will always stay by your side.
Wow, such inspiring words, Mary. Good job. This is my colleague, Janeda. She's here with us today to help teach us how to put insulin using this syringe. Janeda?
This is the syringe and this is the insulin. Always keep the insulin in the refrigerator. But the syringe, then all the way to 100 units. So the doctor's order is 5. So half of the then here of the syringe, that's the one you will spray for the insulin. So the side to inject the insulin is upper outer of the arm, the fatty part, both arm, and even the abdomen. Always two finger between each injection at the abdomen, and then on the thigh. So when you inject the insulin, always remember 45 degrees of the insulin when you inject it. Like if you poke it on the hand, it's 45 degrees, not straight injection.
Can I ask a question? Why do we need to change the side for the shot?
We need to rotate the injection of the side so it will not be hardened.
Thank you. But what about if the sugar is too low, like below 100? Will I give the shot?
Do not give the shot. Instead, let him eat and wait for another hour and then you recheck it again. If the sugar is too high, give them the insulin and keep monitoring the sign and symptom.
Okay, wait, so how are we supposed to know if his sugar is too low?
He would be complaining of hunger, shaky hand, and sometimes perspire too much, and sometimes his level of consciousness will be changed. Then that's the time to check the sugar using this machine, glucometer, that will check the blood sugar level, and then prepare something sweet for him to drink.
Soda. See? That's the one I used to drink, and I feel better.
Soda could be too sweet, Mr. Carrison. Maybe it is a lot more healthier if you buy fruit juice, bread, biscuits, fruit juice, or any protein source.
Mr. Jano, there is no restriction on what to eat, but eating right amount of food and right food choices is more beneficial.
Mama, I think we should prepare more local foods instead. Am I right, nurse?
Absolutely, yes. Local food are healthier. Starch are common in our island because they are considered as carbohydrate. Better as combined as the right rice because it's considered or contain the simple sugar for our body to digest.
But again, Mr. Garrison, right amount. And I think you should make use of the local green vegetables and the fruits. But again, some fruits are too sweet. Just a slice of it would be enough instead of the whole fruit. Okay?
We do have a lot of fruits. So you mean we are not restricting him to eat those, but eat the right amount, right? And how do we know the right amount?
Yeah, wouldn't it be more harder for us that we have to do the math every time we serve him?
I know how you feel about it. And I will give you an example. Say you have a big taro or sweet potato 1/4 of it would be enough. And green leafy vegetables of at least half of your plate. And a small to medium size of a slice of the meat of the fish would be enough.
Okay, thank you. That makes sense.
And make sure to give him the shot with meal or before meal.
Makes sense. Because if we give him the shot without meal, then its sugar will be low soon.
Exactly, Mary. Anything you want to ask?
No, thank you for your time. I think we're fine for now.
Thank you, family, for your cooperation, and we did enjoy helping, teaching you, informing you. Keep it up. Mr. Carrison's illness can be controlled with medications and proper diet. Thank you very much, family.
Thank you, and Dr. Yang will be coming to see you.
As the number of people with diabetes continues to rise across the world, the role of nurses and other health professional support staff is becoming increasingly important in managing the impact of the condition.
Hi. Good morning, Mr. Chana. How are you feeling?
Much better than the other day. But I'm kind of confused of all those pills and shot to take. And I think controlling the food that I eat is the big deal for me.
Okay, I know how you feel about it, but this little adjustment is for your own good. We are not telling you not to eat, but of course to eat the right food, right amount, and religiously taking your meds. Patience.
Doc,
Thank you, Doc.
when can we contact for the follow-up?
Anytime you feel like it needs immediate attention, like if it's unresponsive, running fever, or the wound gets worse, then you can come back anytime. But my advice is to come back after 3 months so I can check him again.
Thank you, Doc.
Oh, and one more thing. Since patients with diabetes are more prone to infection, especially now with this COVID pandemic, I would highly suggest you strictly follow the healthcare protocols to avoid more complications.
Like what, Doc?
Like avoiding larger crowds and if necessary use masks, social distancing, and maintaining good hygiene, especially hand washing. This will help you protect from any kind of infection.
Thank you so much, Doctor. We've been hearing a lot of news on the radio and from the health services, and I'm scared.
Okay, so we'll be discharging you today. Okay, keep safe and take care of yourself. I'm gonna see you after 3 months, okay? Trina will be here in a minute to teach you about other matters to help you recover.
Good morning. At your service, I'll be the one cleaning your wound and teach your family how to clean it when you guys go home.
I'm just gonna lift that up, right?
So, when you clean the wound, we use normal saline to clean it. So, this is sterile. So, when you clean, see the wound, because in the wound, it's this part is cleaner and this one is dirty. So, when you clean, you start from inside the wound. You from the center, then goes around the wound, then go outside and draw. And then second time, same thing. Clean from the center, then go out. and this third one. Okay, the last one, you moist the gauze. This is what you will use to put in the wound before you cover it. So here. And then you get your dry gauze. If symptoms of infection continues, like swelling, pus coming out from the wound, redness, pain, and he develop fever, come back anytime. Don't wait. Just bring him to the hospital. Huh?
Did the doctor give us medicine for that?
May I see the prescription, please? Cloxacillin can help prevent further infection. So he needs to take the medicine up to 7 days.
Nurse, so can we use local medicines at home, like if we were to boil guava leaves and use it for cleaning wounds?
Sure. Guava leaf is better for cleanser, but still he needs to continue taking his medicine and clean the wound properly. Chano, when you go out, make sure you wear slippers, because in diabetic people, their pain sensation is out there. Means it's numb. They don't really feel pain. And you guys make the environment clean, just to prevent bacteria.
Oh, that is why I didn't even realize he stepped on something.
I think I'll be in charge of taking care of his foot starting today.
Wow, thank you. You're such a good daughter. Jana, you're so lucky. You have a very responsible daughter who is willing to do this. Am I right?
Maybe. Thank you.
So let me call my other colleagues, the nurses, to come and teach you how to do the range and motion exercise.
Hi, Mr. and Mrs. Carrison. Miss Carrison, I'm Lisa, your nurse again. I'm here and we are here to help teach you how to do your leg exercises at home. These exercises are to help you fasten your recovery process so your wound could heal faster and you could walk much faster.
Front. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Range of motion to the right. 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. To the left. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, touch your toes. On the count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, right first. Lift, then extend down. 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 Last one. Lift, then extend down. Lift, then extend down.
You can do it at least once a day, every day, until you're fully recovered. Then, when you know you've got all your strength back, you can jump to the next level.
Let's do this at home.
Yes, we should.
As a highly valued member of the community, nurses do outstanding work to support people who either live with diabetes or at risk of developing the condition. The need for more education and funding to equip nurses around the world to improve their knowledge and skills to better support people with diabetes and those at risk of developing type 2 diabetes is vital. With more advanced knowledge and skills in diabetes and diabetes management, nurses can make the difference for people affected by diabetes.